Hello everyone. My name is Catherine Truesdale, and this is Team Up for a Patient Experience.
Hi there, I'm a member of the team. I'm Sandy Shirk. And we also have...
Hi, my name is Janice Walker, and I'm part of the team.
Hi, my name is Silvia Benitez, and I'm part of the team as well.
Okay, we are doing a webpage content, and we are focusing on patient experience basics, and like to do a little discussion on patient experience, positive patient experience, what's HCAHPS, and what areas of patient experience are hard to measure. Okay, what I came up with, would like to discuss briefly. Patient experience are all interactions with patients in hospitals that will influence how the patient perceives how their care is. And what I think contributes to a positive patient experience is always considering the patient's care and needs, good service and quality, and engaging and empowering the patients and their families.
Sounds good.
Yep, and thank you. And HCAHPS and how it's used. It's survey and data collection that measures patients' perception of their hospital experience. And we use that to compare with other hospitals to improve quality of care and enhance accountability in healthcare. Areas of patient experience that are hard to measure: communication, trying to figure out if a patient experience is good or bad, is all in the patient's perception. I did a case study, and the case study was from Coleman Regional Medical Center. And at Coleman Regional Medical Center, they introduced the use of Good to Go at discharge, and this is a device that records live discharge instructions between the patient and the caregiver, and it captured the whole conversation. The patient was then able to review the recorded discharge communication, clarify, ask questions, and put it into their own words for ease of understanding their instructions. They then were able to have access to hearing this recording on a landline phone, mobile device, or a computer at any time after discharge. This program greatly improved the patient experience, and based on this case study, it allowed for a 7% reduction in hospital readmissions compared to patients who did not use Good to Go, and 100% of the patients said it improved their understanding of their discharge instructions. Along with making such a positive impact on the patient experience, it also was considered a best practice by the Joint Commission. So that was my case study that I focused on.
Very good.
And why that program helped improve the patient experience. So that's what I have to say about that. So,
does anybody have any questions for Sandra?
Yeah, any questions, comments?
Not for me, no. Very well explained.
Very good. I understand it as well.
Okay.
Okay.
Thank
well,
you.
I'm number 3. I had patient experience number 3, so I'll go next, following Sandra. My definition regarding patient experiences: continuously building trust and confidence with each opportunity of delivery of care through communication, understanding, and treatment, while improving health outcomes for all members. So that was a definition that I had put together regarding patient experience. The next thing that I need to discuss is the key factors that contribute to a patient experience. For me, I think the key factors that contribute to a patient experience was awareness, knowing, anticipating, and addressing patients' needs, behaviors, attitudes from staff, physicians, and all staff, which demonstrate and reassure the members that they're the patient's main focus. Also, delivery, providing coordination and the appropriate help to each to each level of care, throughout each level of care for members, whether it be appointments, referral, coordination of care, treatment and education, and just the whole environment itself. So pretty much that was my key factors that I had towards contributing to a positive patient experience. What HCAHPS is and how it's used, pretty much exactly what you said, Sandra. It's basically a survey which is used naturally to collect data on the outcomes of the patient's hospital experience, inpatient admission experience. It has some core questions. I believe it was 27 questions, which was asked. The 3 goals of the questions is divided into basically surrounded around getting results for the hospital, comparison results to see how the hospital did on patients' interests, in areas where the patients wanted to know about. The other areas were providing the results would prove to be incentives, could create quality improvements for the hospital so that they can get incentives and get additional money paid to them by the government.
And that's always a plus. Yeah.
It is. And then the 4th thing is a positive, I guess, feedback for the hospital, which would introduce more patients to the hospital because it would be word of mouth. The hospital would get around as being a good place to go.
So that's more patients, more money. Yeah.
Exactly. So
I really liked your patient experience statement stating about the patient being the main focus.
Okay.
So I think that was good. And that's a good case study also.
Okay.
Another good case study.
And the areas of the patient experience that are hard to measure and why. I felt that the areas of patient area that was hard to measure and why, one was the patient's suffering, because you need to know, because suffering can be coming from different directions. It can be coming from the patient's disease, or it can be coming from the treatment of the condition itself. So that's why patient suffering was an area which could be hard to measure. The other thing that I thought was hard to measure was patient satisfaction, because it's hard to say what it takes to make me satisfied specifically, whereas your requirements are something different. So I think satisfaction and communicating that is something which is hard to measure.
It is very hard.
Experience. And my explanation of the case study example was a case study conducted in Raleigh, and I'm sorry, in the hospital, and at Raleigh Hospital, the hospital introduced bar scanning technique at bedside. And what it did was, while the patients were inpatient, the nurses went from writing down by hand the next medication that was being introduced and prescribed and given. They scanned it. By moving to this new technique, it reduced the risk of wrong medications being given. So it became very popular among patients and the nurses. They caught on very quickly. The nurses caught on quickly. It also allowed the nurses to provide additional educational opportunities to the members right there in the hospital, letting them know what some of the major 3 risk factors or side effects of medications were that the members were being given. This also helped to alleviate concerns of the members while they were in a hospital. The other thing that they did at the hospital was because it was well received from patients and physicians while inpatient, they're now looking to implementing this at discharge. So once the patient is going home, again, scanning of medication and discussing the side effects will be implemented, so that patients can understand what the new medications that they will be taking as they leave the hospital, because medications can change from the inpatient basis to the outpatient basis. So that was my case study and why I felt that it was a good, positive experience.
And safety is very important. So that's a good safety.
Thank you.
Very good.
Questions or concerns?
Especially knowing how medications change on all the time, different brands. So it's very important to have that type of scan to know that you're giving the right medication to the right patient.
Exactly.
Correct.
Exactly.
Very true.
Exactly.
Very true. Very well explained.
No, thank
Yes.
you.
Very good.
Okay,
Okay.
next.
Then are we going by 2, 3, 4 now?
Yep.
Mhm.
Okay, so I'm next, and well, my brief definition for the patient experience will be actually is what is the satisfaction of the patient or their perception when they walk in into the clinic, to the hospital, and how they come out of that experience or how they come out of the visiting their doctor or hospital. How satisfied are they with their visit? To me, patient experience, that's the definition. Of course, we want to give them a really good, great experience for most of the time. But that to me will be the patient experience. How satisfied are they going to be when they leave the hospital or the clinic? Moving on to the key factors that contribute to a positive patient experience. I will say again, it is how we treat them when they walk in, or how we make them feel comfortable, listen to them from the first phone call they make to the check-in time when they walk into the clinic, or talking to the nurses, doctors, and leaving the hospital or the clinic. So those are, for me, are key factors that will contribute to a positive, how we treat them and be compassionate to them. Moving on to what HCAHPS are. HCAHPS, sorry, is actually the Hospital Consumer Assessment of Healthcare Providers and Systems. So it's a survey that has been standardized, nationally standardized by just to measure the patient's perception of their hospital or doctor's visits. So pretty much the hospital's visits, trying to see how well are they doing, and also get reimbursement from the, I believe it's the Center for Medicare, Medicaid,
Mhm.
that pays them back. So that's another way of them receiving that payment from them. So it's very important. I think it's very, very important to know that they are, following through and getting their payment for what they do and taking care of the patients very well. And then I would say what areas of patient experience are hard to measure and why. Same thing too. I would say satisfaction is one. We cannot tell what the patient, when they walk in, how to measure that. Sometimes people think, oh, I'm going to get this type of experience. I want this type of nurse or this type of person to treatment. And how do you measure that? Sometimes it's kind of hard. Of course, you got to be compassionate and show sympathy. And but most of the times I think that's hard. And communication, I want to bring that up too, because it's hard to know what they really are trying to tell us and how to handle things. And moving on, really quick here. I know we are trying to get on time. So my study, actually, my case study was the transforming patient-centered care in the oncology department, and that was actually a survey or a study done at the University of California, Irvine Healthcare. They actually were transitioning towards the relationship-based care in order to provide a more patient care. Just kind of like a case manager. Basically, when the patient walks in, they want to have one assigned nurse to that patient and that family that will follow them through the whole treatment. Instead of the patient coming in and seeing different nurses, different people, they don't know what the patient, their history is brand new to them. The nurses don't know much about the patient or the family, so they were trying to see why the patients were not coming back or didn't, were not too happy with the services. So they created that program, and it actually followed them through the entire treatment. And actually, they saw really, really good results. In 2006, the oncology unit was ranked in the 58th percentile at 72% top box. But by 2010, the unit had moved to the 87th percentile with a top box score of about 81%, which is a huge improvement. And they actually saw a big improvement, how the patients felt with the nurses, that relationship changed tremendously, and their communication also changed a lot, and it improved a lot too.
Very
So
good.
that was,
Very good. Very
thank
good.
you, thank you. Any questions, anything?
No, I think it was really detailed. And
Very
gave a lot of-
detailed, very good, very important
Thank you.
Thank you, thank you.
case study.
Well, I'm next. I have case study number 1. And my definition for patient experience is that the patient experience begins when you first contact you have the first contact with the patient, and you make them feel like welcome, or like by the interaction that you have with that person by telephone or in person,
Mhm.
and you make them feel like they're at home, or make them feel like they can ask you a question. They're not like, afraid to ask you a question or say something, because a lot of times people remember, or patients, we remember basically how somebody makes you feel, not what they tell you. Especially patients, when they get to the hospital, they're sick, they don't want to hear anything, or like it's too much information you're giving them at the same time all at once, and they just remember how you treated them. So that's my patient experience.
Okay. Very good.
I was assigned to do the case number 1, which is called the Cape Coral Hospital Notes. And this is a strong example of a program that improved the patient experience, because they built the issues needed to improve. So they created a blog.
Mhm.
Was the voice, I guess, for the hospital. And with this blog, well, they were able to do connection with the patients, and the hospital was able to create a friendly improvement or friendly atmosphere, that was to decrease the tension and the stress with new and old patients. So this was something very interesting, because with this, they were able to help the staff and be able to know what they needed to improve, because a lot of patients were either happy or unhappy with the service. So this kind of helped them out with that.
Okay.
Very good.
Very good.
Very good.
Very good.
Case study.
I think everything was. I think the case study was very good. I think everybody's content, everybody's information and delivery was really good, and it kind of makes it hard for us to decide where we're going to go. I think
Right.
since we all gave very good information, detailed information, I think it may be easier if we just all take one of these bullet points and kind of put it together and come back and see how we like that this puts our content together, our webpage text information together. How does everybody feel about that?
I
Same.
feel like that's a great idea. Yeah.
Yeah.
So, if anyone doesn't mind, I can go with a definition of patient experience and the key factors that contribute to a positive patient experience.
That sounds great.
Sounds good. I think I can put that together and submit that information for everybody's review to see how
Okay.
that comes out.
And I
Okay.
think I'll take an explanation of the case study example of
Okay.
the group to of my case too, if that's okay, since we all thought all the cases were good.
Yep.
I
think-
think that one's good, and I think it had a lot of points to improve patient experience.
And plus, I think yours had some measurable outcomes, so I think that's a good idea if you do take that also. That's great.
Okay.
Sounds good.
Great.
Okay. And I'll probably take, I don't know, Sylvia, do you want to take one, or?
I'll try the HCAHPS.
Okay. Sounds good.
All right, so that's left me with the, is that the patient experience hard to measure, or no?
Yep,
Wait.
that's it. That's what you have. Mm-hmm.
Yep.
Okay,
Okay.
I'll take that.
So we'll all put our content together and submit it,
Yes.
Yes.
and
Yes.
with our citations.
Mm-hmm. With this
Yeah.
item.
Once again, what case we decided to do?
We're going to do a case study 2, the one on the that I had presented on the Good to Go.
Well, okay, sounds good.
Discharge.
So we're good. So we were going to go with Sandra as our major case study for our group. If
Mhm.
everybody sends their information, put it together and forward it to me, I will take the job of putting it all together and we can all review it and make sure everything that if there's any corrections or feedbacks that's needed or omissions, we can put that information there and then send it in for approval.
Sounds like a plan.
Sounds
Works
good.
out.
Sounds good. Okay, well, it sounds like we all agree. We all have our assignments, and this will conclude the recording of our meeting.
Yes.
Okay, thank you very much, ladies.
Thank you.
One moment, I'm going to stop
Thanks.
broadcasting.